I chose hand washing to prevent the common cold as my topic. I chose this topic for my speech because it is a common problem in healthcare, like in the hospital. Nurses and doctors are always taught to use hand hygiene when coming in contact with patients. Whenever I started the health science program when I was in high school, we were taught to use hand hygiene to help control the spread of infection. Obviously, you cannot stop all germs from spreading. There's germs on things that we don't even think of. Cell phones are a huge transmitter. Our hands are too. How would you feel if you were a patient and a doctor who just got done delivering a baby and just came to care for you and never washed his hands in between the other patient and you? The common cold can be defined as a viral infection of the upper respiratory system, which includes the nose and the throat. If you have ever had the common cold, which majority of people have, you know it's not fun to have. The most common symptoms will include a runny nose, congestion, and sneezing. Some of the other symptoms are body chills, fatigue or tiredness, sore throat, and watery eyes. Sometimes a fever will also result. Some of the treatments include over-the-counter medicines like Dayquil and NyQuil or Claritin. If you go to the doctor, you will obviously get a better alternative than the generic pharmaceutical drugs. Research has shown that hand washing is the number one prevention for the common cold. Some people don't know the effective way to wash your hands. Yes, you can just stick your hands under running water. This will get some of the germs off of your hands, but it won't be as effective as washing them in the correct way. First, you gather your accessories such as a paper towel, soap, and an orange stick. Make sure you take off all your accessories such as your rings and watch. Keep in mind not to let your uniform touch the sink, especially if you're in a healthcare setting, and to keep your hands lower than your elbows. Turn on warm water and rinse hands from wrist down to finger. Pump adequate soap on your hands and lather it on both palms of your hands for 20 seconds. Wash the backs of your hands for 10 seconds each. Then scrub both wrists and lower forearms. Scrub in between each finger, and if it's available, use an orange stick to clean each nail. Rinse off your hands from wrist down to your fingers. Dry one hand starting from fingers up to your wrist. Throw the paper towel away and then use another one to dry the other hand and then throw that one away. Use another paper towel to turn off each handle, then throw it away. Use lotion if it's available and clean up your mess. I think everyone can benefit from hand washing to prevent the common cold. It obviously prevents germs from spreading, as we discussed earlier. It prevents us from getting sick easier. It also prevents life-threatening diseases. It also plays a huge role in our personal care and hygiene. Nurses and doctors will notice a difference in the hospital. Hand washing will decrease the risk of nosocomial infections. Nosocomial infections are infections spread in the hospital. I was able to observe a nurse at Methodist Hospital ER. She said that hand washing is always the best method. She said that Methodist is always conducting studies to see which method is better, and results always come back to show that soap and water are always better than hand sanitizer. In the 19th century in Vienna, maternity patients were dying at a quick rate. A doctor there, Dr. Ignaz Semmelweis, made sure that his nurses were washing their hands appropriately with soap and water before working with patients. This drastically changed the death rate. The reason behind it all was that working with corpses to patients to nurses' hands. Some of the benefits are by washing your hands, it prevents eye infections. It lowers the risk of getting an eye infection like conjunctivitis or pink eye. This causes irritation to the eyes that causes itching. This spreads germs from your hands to your eyes. It also prevents lower respiratory infections like the flu or the common cold. During the flu season, the most common thing you hear is to wash your hands. The germs that are usually found on surfaces like our hands and doorknobs are the same ones that cause problems like diarrhea. Hand washing decreases that risk. Diarrhea is also one of the leading causes of death in children. This is another picture. Hand sanitizer is another alternative if soap and water are not available. Apply a dime-sized amount to one palm, then rub both hands together and make sure it gets all over hands, in between fingers, and under nails. It should take your hands 30 seconds to completely dry for it to be effective. People think that hand sanitizer can kill you if you drink it because of the ingredients in it. It can be fatal because of the high alcohol concentration. It's easy to drink more than you should before you feel the effects. There have also been reports confirming that children need medical supervision or needing medical attention after using hand sanitizer without being under the supervision of an adult. If a child is to drink hand sanitizer, it can lower blood sugar. If it's extreme and not treated, it could lead to the child being in a coma and having seizures. If a child drinks it, you want to immediately give them something sweet to drink and call poison control. The specialist can then calculate how much was swallowed compared to their body weight. If the amount is too extreme, they will send the child to ER so they won't have breathing issues. It can also make the children drunk, not just woozy. They will have a slow heart rate and breathing. The child will probably start vomiting from the reaction to the alcohol in the hand sanitizer, which is completely normal in this situation. If they don't vomit immediately, the child could become seriously ill. You always want to contact your poison control if a child comes in contact with hand sanitizer to ensure everything is okay and not worry. I think we can implement this solution. At Walmart, they make an announcement over the intercom to remind their employees to check their areas and ensure it's clean. Every hour, the hospital can have an announcement over the intercom that reminds nurses and doctors to wash their hands.